What is Frothy Sputum? Frothy Sputum is foam-like mucus coughed up from the airways. It is a sign of respiratory distress and can occur in association with a number of different medical conditions. Patients who develop Frothy Sputum should make an appointment to see a medical professional and may want to consider an emergency room if they are having difficulty breathing or feel extremely disoriented. Some respiratory illnesses onset very quickly and can be fatal or severely debilitating if not treated rapidly. Patients with Frothy Sputum may cough more than usual and produce foamy clots of mucus. Sometimes it is tinged pinkish, indicating that bleeding may be occurring in the airways. In a medical evaluation, a doctor may take a sample for analysis in a pathology lab. An evaluation can determine if the Frothy Sputum contains viruses, bacteria, or other clinical indicators that might explain why it is occurring. This can be a symptom of pulmonary edema, pneumonia, congestive heart failure, or tuberculosis. Patients may also wheeze and have difficulty breathing and could develop an irregular heart rate. To treat Frothy Sputum, medical providers need to find out why it is happening. They may support the patient with an oxygen mask, elevated bed, and other measures. If necessary, the patient can be intubated and put on a mechanical ventilator. In a person who has an existing respiratory condition like chronic asthma, Frothy Sputum can be a sign of a flare-up or failure to respond to treatment. It is advisable to call the person who supervises the patient's medical care to discuss the symptom and determine the next step. A wait-and-see approach may be advised, or the patient might need to come into the office for evaluation. The sudden development of Frothy Sputum in someone who is otherwise healthy may be a sign of a rapidly developing lung problem that requires immediate attention. Some of the conditions known for causing this symptom are contagious. To be on the safe side, patients should cover their mouths when they cough and dispose of any tissues appropriately to avoid transmitting organisms to other people in the area. If they are feeling well enough to engage in normal activities, they may also want to stay home from work or school until the cause is determined so they don't expose other people to an infectious agent. People who have been evaluated and know they are not contagious can make other people aware of this to reduce any concerns they might have. Pink Frothy Sputum may be an indication of many ailments, including pulmonary edema. Pulmonary edemas occur when the heart is no longer able to pump blood effectively. This causes an increase of pressure in the veins of the lung, which in turn pushes fluid into the lungs' air spaces. The fluid then accumulates, causing difficulty breathing. Pulmonary edemas are often triggered by congestive heart failure, which may be a cause of pink Frothy Sputum in and of itself. In these cases, the heart gradually reduces its blood flow, and the backup of blood can make its way into a person's respiratory tract or esophagus, both of which could cause pink Frothy Sputum to occur. These aren't the only conditions that can cause pink Frothy Sputum, though. It may also indicate that you have pneumonia. Pneumonia is when the air sacs of the lungs become infected and fill up with fluid. Symptoms include sharp pains in the chest, dehydration, and coughing up pink Frothy Sputum. Why does pulmonary edema cause pink Frothy Sputum? The pink Frothy Sputum that's caused by pulmonary edema happens for several reasons. Technically speaking, it is the result of two problems, the first of which is the frothing. Frothy Sputum indicates that the mucus that naturally occurs in the lungs has been combined with air or fluid. This is a symptom of respiratory distress. The second problem is the pink color. This is usually the result of blood that is mixed with the sputum, and it is an indication that capillaries may be leaking into the lungs. Respiratory distress and leaking capillaries are both symptoms of pulmonary edema. Pink Frothy Sputum thus occurs when pulmonary edema causes blood to leak from capillaries and into the air sacs of the lung. The accumulation of fluid in the air sacs causes the frothing to appear, and the leaking of blood causes the pink color. As this happens, a person may cough in distress, causing the pink frothy sputum to emerge. Frothy sputum heart failure. Frothy sputum is closely linked to congestive heart failure, so when it appears, a person should seek medical attention immediately. This is especially true in instances when pink frothy sputum is accompanied by other symptoms such as lightheadedness, nausea, malaise, and pain in the chest or abdomen. All of these symptoms are an indication of heart failure and should be treated as a medical emergency. Even if you are suffering from heart failure, though, pink frothy sputum does not necessarily indicate a fatal diagnosis. Rather, it should be taken as a warning sign, prompting you to take preventative measures and pursue treatment. If there are any lifestyle factors that may worsen your risk of heart failure, you should improve these immediately. Losing weight and exercising more, for example, can massively decrease a person's risk of heart failure. You should also stop smoking if you smoke. Take steps to reduce stress in your life and limit your alcohol intake.